The following is a statement by Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone, on the BVI's strategic guidance in responding to COVID-19 titled, Preserving Our Success to Protect Our Future.
Transmission must be controlled. As of the last figures reported, Mr. Speaker, all indications pointed in this direction, as we have not yet detected and confirmed any evidence of local transmission of the virus COVID-19. Second, the health system capacities are in place to detect, test, isolate, and treat every case and trace every contact. I'll once again remind everyone that the British Virgin Islands can only have all of the equipment and advanced facilities that we need if the BVI need none of the equipment and advanced facilities that we have. Mr. Speaker, this condition can change in a moment's notice. Mr. Speaker, we are blessed to have well-trained surveillance and contact tracing teams. In our in-country PCR testing capabilities, which, as you have learned, supplemented by test kits donated by Public Health England and a 14-bed isolation ward at the Dr. D. Orlando Smith Hospital. Arrangements are being finalized to launch a patient application for Android and iPhone to assist patients who have been diagnosed, suspected, or on quarantine to be able to communicate with the physician conducting their care and track their symptoms. Configuration is largely completed and testing begins this week. The BVI Health Services Authority has constructed a screening and assessment area outside the emergency room. Its capacity is 20 to 30 mild cases per hour, with severe cases being referred to the main emergency room. The government has received 4 new Hamilton C3 ventilators and associated equipment to supplement existing capacity at the hospital. This brings the total ventilator ICU bed capacity up to 9. 2 of the new ventilators were purchased with special funds approved by Cabinet. The additional 2 were special donations from Dr. Henry Jarecki. I wish to publicly acknowledge and thank Dr. Jarecki for his kindness and generosity towards the people of the Virgin Islands. The third criteria is that outbreak risks are minimized in special settings like health facilities and nursing homes. The BVI continues to implement vigorous infection control measures and steady increase or stock of personal protective equipment, PPEs, despite being impacted by the supply chain restrictions experienced globally. And if I am allowed one insertion, I am pleased that His Excellency, through the media, has actually confirmed confirmed the release of the $12,000 worth of PPEs, which was part of the $8 million, yes. The BVI Health Services Authority is pleased to receive a donation of PPEs, including masks, Tyrex suits, and related items through the generous donation of the Bank of Asia, Unite BVI, and others to be named. An additional supply is expected to be coming in the coming weeks through the UK government's Crown agents. The fourth area of focus is to ensure that preventative measures are in place in workplaces, schools, and other places where it is essential for people to go. In this regard, we are renewing the appeal to businesses or business owners, managers, employees, customers, and volunteers throughout the public, private, and non-profit sector to install and make consistent use of facilities for hand sanitization, personal hygiene, and physical distancing of at least 6 feet between persons. Mr. Speaker, I pause, and I have it written, to issue very strong words of caution to those of us who have insisted that you must have the services of your hairdressers and barbers. Let us not win the battle and lose this war. Even at the risk of being accused of fear-mongering, the total membership of this House of Assembly would rather err on the side of caution. It is strongly advised that persons venturing into the personal space of others must wear their protective gloves and N95 mask and ensure that equipment and surfaces are constantly sanitized. Mr. Speaker, COVID-19 and the effects of it is real. It is not, let us not get weary in well-doing. Mr. Speaker, COVID-19 kills. The fifth consideration is to ensure that importation risk can be managed. As the Premier and Governor have stated, all borders remain closed to inbound passengers, planes, and vessels, which allows us the opportunity to carefully manage the phased internal reopening of the territory. During this period, we continue to build capacity to manage the risks associated with the arrival of our family and friends who would have traveled through or from affected areas. Critical elements of our preparedness include enhanced port screening arrangements and the commissioning of facilities to ensure that all arriving travelers can be safely and securely quarantined for 14 days. We urgently need the support and cooperation of the hospitality industry in order to make any border reopening plan a success. It is our goal to secure 150 or more rooms that would be utilized to house returning nationals, belongers, and unrestricted residents. In this regard, we are in conversation with a number of facilities who, in fact, have made calls to this office so that we can begin the negotiations. In terms of the WHO, it is important to ensure that communities are fully educated, engaged, and empowered to transition through this period. Many things in life will never be the same again because of the COVID-19 disruption. We all need to address our minds to this new reality, so many aspects of it remain unknown. I encourage you to remain abreast of current information from credible sources such as World Health Organization, Pan American Health Organization, Caribbean Public Health Agency, and the BVI government media resources. The sources cited are frequently Testing one again. I'll start that paragraph over. I encourage you to remain abreast of current information from credible sources such as World Health Organization, Pan American Health Organization, Caribbean Public Health Agency, and the BVI government media resources. The sources cited are frequently updated by the Joint Information Cell of the Health Emergency Operations Center. Vulnerable households that are experiencing hardship at this time are reminded that social workers can be reached by dialing 468-9371 or 468-9384. The Social Development Department, working in tandem with the BVI Red Cross and the Family Support Network, continue to find or to field requests for special assistance. Arrangements have been made for homeless individuals to be provided with meals and other support services. Arrangements are also in place for persons needing prescriptions refills so that prescriptions can be emailed to pharmacy, PHARMACY at bvihsa.vg or sent by WhatsApp to 440-1726. Information including the patient's phone number and address should be included. Once filled, BVI Health Services Authority staff will deliver the prescription directly to the patient. Person needing any COVID-19 related or any medical consultation can call the medical hotline at 852-7650 and can be booked for an online appointment review. Ladies and gentlemen, Mr. Speaker, I cannot thank enough all our frontline workers, including health professionals, emergency and essential workers, and all of the network, together with the HEOC, under the HEOC, for their selfless service in helping to protect the people of the Virgin Islands from this deadly disease. I also acknowledge the personal sacrifices that each woman, man, and child in the Virgin Islands is making at this time in order to keep us all safe. By staying at home and complying with the curfew orders, either now or in the future, despite the inconvenience that it brings, you are doing your part to help stop this deadly virus and save lives.
The proceeding was a statement by Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone, on the BVI's strategic guidance in responding to COVID-19 titled Preserving Our Success to Protect Our Future.